Hi, it's Dr. D here with Bob. Hi, Bob.
Hi, how you doing, doctor?
Good. We've been having a chat about expanding this ministry, about helping more veterans, and we're just talking about the sadness how the study that we talked about in 2010, how there were 20 veterans a day committing suicide. And the Veteran Affairs came out with this study that shows that over 800,000 veterans are suffering from post-traumatic stress disorder. And really, I have to credit you. You brought this to our attention, and now it's becoming a ministry. We have a nonprofit that supports veterans for post-traumatic stress disorder. So, why don't you speak a few seconds to that, and then I can talk about some of the science and what we're doing.
Okay, and Dr. D says that it's crediting me with this, but I became more aware of helping people with PTSD through Dr. D. And I think that it's something that through neurofeedback we can do so much to help so many veterans, and I think we're just getting started right now. So with your help and support, we can do more to help these vets get better, and there are thousands and thousands of them out there that need our help and support. So through understanding more about neurofeedback, maybe I can get you on board with helping us with this ministry.
And let's talk about your website so they can how to donate and how they can see your website. They can look from there and find out for Irvine.
budsodyssey.com. They can find out more about how to give money through Hands for Life to help these vets. So if you follow that, you can give from $1 to as much as you want. You can give it one time only, or you can give it monthly. So I appreciate any help that you can do to help us with this ministry. Thank you.
I'll speak to the part of this that the veterans are underserved with. As Bob was talking about in our chat, most of these veterans are just giving medications, which doesn't correct the underlying post-traumatic stress disorder. It obviously sedates them, it medicates them, but we know that post-traumatic leads to suicidal tendencies. It leads to people who can't find work, depression, chronic anxiety. We've had a number of people with night terrors. They wake up every night with extreme nightmares, and people just in general can't fall asleep. And the reason why they can't fall asleep is because they're always on heightened alert. Their body is learned to live on what we call the fight-flight response. So, in fact, we're just talking about a study that just came out here in 2014. They did a study which showed that people who received neurofeedback training actually trained this, what we call alpha theta state, had immediate increased feelings of calmness and peace, helps their sleep, helps their insomnia. In fact, we get about an 80% success rate just with the neurofeedback. And not only do we do that in our office, but as we were talking about earlier, we also do a lot of brain support. We do a lot of brain chemistry support. There are studies that show that people with post-traumatic stress disorders, they can measure these things called stress hormones, these catecholamines, in their urine. So we know that stress drains the brain chemistry of positive neurofeedback, neurotransmitters, so we know how to support that. So there's so much we can do to help relieve these vets suffering, and we love to partnership with other ministries, and we'd love to see how far we can take this so we can help these veterans where they're so underserved.
Absolutely. We're just beginning, so please help us, and we're going to make this into something that's going to be spectacular for helping a lot of vets.